This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
The COVID-19 outbreak was a sudden and terrifying experience for everyone worldwide. I remember telling my friends that the virus would not last for a long time and that we would all meet after 2 weeks of self-isolation. I did not know how far it would go and what changes to my life it would bring. Sitting at home and watching the news about millions of infected and fatal cases made me realize how fragile human life is. The pandemic has both positive and negative effects on people and their businesses. This paper addresses these effects and provides my experience of the COVID-19 healthcare crisis. The virus that is still ongoing has taught us a valuable thing for all of us, which is being able to adapt to rapidly changing circumstances. You will never know what is waiting for you in the future, and you should be flexible and calm enough to embrace the new reality. At the pandemic's beginning, it was fun to sit at home, watch TV series and chat with my friends. Yet, after some time, I realized how my mental health was going downward as I started to feel anxiety about the world and my future. I also felt very sorry for people who lost their close ones because of COVID. However, I somehow managed that stress due to mental health support, podcasts, and books. I realized that being able to adapt to a changing reality is the only way to keep doing daily routines. At a country level, countries were also adapting and making new policies, and I think now many political figures are more flexible, being aware of sudden changes. There were too many mistakes to realize the importance of effective and fast decisions that consider today's reality. One more positive thing about the pandemic is that people learned the value of family and socialization. People cannot live alone, and they need someone to rely on and care for. During the pandemic, I was with my family, and I think it was the first time interacting with them so closely. We discussed the situation and shared personal concerns so that I could understand my family more and support them. I was also worried about older family members, thinking that I did not appreciate time with them before the pandemic. It made me reconsider my family relations and understand that they are my close ones, and I should dedicate my time to them more. I assume this was a great lesson for everyone, and I hope people would value their families and take care of them. Online education is one of the crucial changes that the COVID-19 outbreak brought to us. I did not know how to assess such kind of education as positive or negative, as there are many arguments for each side. Personally, I liked the online mode of the studies because I could also register for other courses provided for free by different universities and platforms like Coursera. I also learned how to manage time properly, as the increased number of assignments forced me to do so. Yet, many students did not like online education as we could not focus sufficiently on our studies. People live in different conditions. Some of us do not have personal space for studying, while others do not have time for education. Education is indeed a privilege, but the online mode made it even worse. Moreover, I heard that in some countries, students climb trees to have access to the internet and do their homework. The COVID-19 crisis increased inequality across the world and harmed the world economy. People in developing countries did not have proper healthcare services and tools for online mode of working and studying. Many people lost their jobs, being unable to sustain their families. Such conditions raised crime rates, unemployment rates, and global hunger, putting many countries in a challenging socio-economic situation. Furthermore, the virus splits people into two categories of supporters of vaccination and those who are against it. This division between people caused social disturbances that made the healthcare crisis turn into an ideological fight. People were making up some stories regarding COVID-19 and not contributing to the solution to the outbreak. I believe such a response from the public is expected, as the general mass wanted answers that government officials did not have. As such, the government should be cautious about how to communicate with citizens. Overall, there is much to say about the effects of COVID-19. It was an experience of taking care of my mental health and being close to my family. For the world, it has disrupted economies, increased inequality, and loss of lives. I hope the crisis made people rethink their lives and be supportive of others. I also believe that the world would not be the same after the end of COVID-19 if it actually had an end. If you want to find more works like this essay on personal experience of the COVID-19 pandemic, head over to ivypanda.com. It has a collection of samples with thousands of submissions covering virtually all academic subjects.